Hii ugonjwa niligundua 2007. Kutoka hapo nikameza hizo madawa mpaka saa hii. Sijaona any shida yoyote.
I was HIV positive na nikaelezwa on how to do na nikapewa dawa, nika follow up to 9 months, ikafika siku ya give birth, my child was negative and now she's heading for still she's negative.
Umepatiana ball, be responsible. Take that girl, muende kwa facility, mpimwe. At least mjue status yako.
Since 2018, Nairobi City County and now under Nairobi Metropolitan Services in conjunction with Unaids have not only reached over 190,000 persons living with HIV with care and treatment, but with life-changing psychosocial support services going beyond the usual. Nairobi City is part of the Global Fast Track Cities initiative founded in the year 2014. On World AIDS Day 2014, the Fast Track Cities initiative was launched in Paris, France, with 26 cities signing up. It has now expanded to more than 300 cities and municipalities by the close of the year 2020. The aim being to get to zero new HIV infections, zero AIDS-related deaths, and zero discrimination.
The Fast Track Cities 1990 is a Unaids target that was set for a specific number of cities, including Nairobi as a fast track city. It is focused at ensuring that cities get to the target of having 90% identification of those living with HIV, having 90% of them on treatment, and ensuring on those that are on treatment, 90% achieve viral suppression.
The county has been all out reaching every aspect of the Nairobi community with HIV testing and counseling services at their facilities, and those found to be HIV positive started on care and treatment, while those found to be HIV negative encouraged to remain so through the necessary prevention methods. HIV services have also been extended to those who inject drugs, men who have sex with other men, female sex workers, border taxi, prevention of mother-to-child transmission of HIV, and of great importance has been to tag along young people in HIV intervention at facility and community levels.
Currently, we have been able to identify 93% of the people living with HIV, and 91% of them are on treatment, and viral suppression is at 94% across all age groups. So we hope that as we move forward, we can be able now to start targeting to reach our 2030 targets, which we know are now 95, 95, 95.
So as someone ambaye is on care and treatment, how was it when you found out you were pregnant?
Okay, sasa nilikuwa na boli yake nikamwambia pregnant. Akaniuliza some mtu yote kwa nayo ugonjwa, nikamwambia atakuwa nayo kwa sababu kuna dawa kumkinga. Na pia ningependa uendelee hizo dawa za PrEP.
We have been able to see the young mothers deliver HIV negative babies, and through the continuous support even after delivery, we are also been able to see how their kids live a normal and healthy life.
Mimi nilizaliwa nayo, so nimeishi tu kuwa nayo, nikitaking drugs nikaji-accept. Pia nimeenda through hizo kufunzwa, yaani ufai uskip dawa, pia unafai utreat mtoi vizuri, sasa ndo get infected. Mtoi ako negative.
When we review our data for the 2020, we saw that the positivity rate of those babies who were born of HIV positive mothers was at 1.5. 2009, the positivity rate was as high as 9%. And right now, if you can see, we are talking about 1.5. It shows that we are having a good success in terms of reducing the mother-to-child transmission.
Kuna self-test kits.
But while all efforts are put to support young women, including teenage mothers, in the fight against HIV, NMS has become cognizant that men, and more so young men, must not be left out.
Sexual partners wetu wakati wako na mimba, kwa nini hatuwapeleki clinic?
Mtu ameenda kupima hiyo AIDS, alafu upatikane nayo. So unaogopa na kutakuwa na stereotype.
Vijana walijiunga wakaform kinaitwa Get Kali, The aim of that ni kueducate the community because HIV nayo imepanda. Nipo kuja kwa facility, health facility ndio ujue status yako au ujue more about your health also.
The group is making sure that condoms inakuwa distributed freely and efficiently to the society. Alafu pia wana create campaign ya kuonesha say condom si kitu mbaya, si kitu immoral kuwa hata na condom.
Sometimes wanasema hii condom iko na this inanuka tayama, this about ni ku kill that mindset for boy child kwa community to come pamoja. Kuna a lot of risk without kutumia HIV. Is about STIs, sexual transmitted diseases.
Unaids has really supported us in terms of technical and financially for the HIV response, and some of the things we've been able to do. Having youth-friendly services, being able to do a survey, being able to understand the challenges and train our health workers to be responsive to the young people. And this has led to an increase in the number of young people that are actually accessing services in our public facilities.
In recent years, the way people move from place to place has significantly changed. With traffic jams in many places, people now prefer boda taxi for ease of movement, and at times, more women than men use them. Boda or motorcycle taxi have been known to take advantage of young women and girls that do not have the funds to pay them for their services, especially in peri-urban areas. This practice of exchanging sex for free rides is believed to contribute to high rates of unplanned pregnancies and HIV infections.
We will go to their stages where they will be waiting for their clients and reach out with the messages on about HIV, the importance of knowing what is HIV, importance of how knowing your HIV status, ways of HIV transmission and how best you can prevent. But also we encourage them to also take an HIV testing services at their workplace.
To advance the cause for good health care for all in the city, Nairobi Metropolitan Services has had to invest in efficient electronic data collecting and collating systems.
We've invested in the right human resource. Second thing that we've done also is invest in the right tools. And once they are able to collect the data on a daily basis, for the sub-counties, we encourage them to review the facility data on a monthly basis. And then for us as a county, we review with the sub-county teams the data on a quarterly basis, so that we are able to see that our data is of good quality and it's that data that is trustworthy.
The County Department of Health has in a period of 6 years adapted and implemented a package of high-impact best practices, including a male engagement approach to engage men as partners, champions of women's rights, advocates, and users of family planning and HIV prevention methods.
In a day, we see approximately 25 to 30 family planning clients, and we make sure that we screen every client that visits for family planning services for the need for PrEP services. Integration of the PrEP services in family planning is important to increase the uptake of PrEP amongst our clients aged between 15 to 23 years because they are the most at-risk population.
To succeed in greater HIV prevention interventions, especially among most at-risk groups like female sex workers, it became necessary for the city-county to roll up an integrated family planning and pre-exposure prophylaxis PrEP programs for female sex workers in the city.
Even if you're using the drug, you also need to use protection. So.
I always come here and taking PrEP because the facility is very good and they are very welcoming. Because even the people who are positive today, if they knew PrEP or if PrEP was there, I think most of them could not have been positive.
The key population visit the facility seeking for services, ranging from the outpatient services, PrEP services, the antenatal family planning. So when they walk in, we're able to identify them very fast and also fast track their process in their facility. So when they go for testing, depending on their results, for example, if they're negative, they are offered PrEP services. They're also given condoms for protection. And if they turn positive, they're sent to the CCC where adherence counseling is done and they're started on treatment and follow-up.
ukikuja usipange laini.
Sex worker akikuja hapa wanamtreat vizuri, sio kama zamani. Hata nilitoa msichana mwingine sex worker alikuja huku kwetu, alikuwa anakuja kwa huduma anafurahi. Hata nakwambia nimeenda kasino ndio walinichukua vizuri, hata sikupanga laini, nenda na yeye barua tena nimerudi hapa.
In a recent workshop with stakeholders including female sex workers representative, it was noted that PrEP offers personal control over HIV and is therefore a prevention option of particular benefit to female sex workers because it can help counter pervasive social and structural factors that limit sex workers' capacity to consistently use condoms to prevent HIV. While specific gender-related beliefs are a cause of stigma and discrimination against men who have sex with men, MSM, acknowledging and working to transform the gender norms that are most harmful to their community have been dealt with to strengthen HIV-focused programs for and by MSMs by continually sensitizing health staff, all the county health facilities, and ensuring availability of clinics that are friendly to key populations.
During my first test, I found that I was positive, so it was a shock to me. After being cancelled, these days, I normally use the condom.
Facility, the public, zinatusaidia sana. The men who have sex with men and the male sex workers and the bisexual men. Hapo nashukuru sijawahi kuoneshwa any stigma ama discrimination. Actually, daktari alikuwa ananiona ananiambia, kijana wangu umekuja na meza vizuri. Kuja chukue dawa zako.
For the last 2 years, we have seen close to 300 people who inject drugs here in Westlands Health Center. We have been offering medical services for them. We have also been giving them psychosocial support, giving them counseling, also supporting those ones who want to stop using the drugs by linking them to the methadone clinic in Ngara.
They're able to be tested for HIV. Even if they turn out to be HIV positive, we're also able to provide with them free HIV services in terms of antiretroviral drugs. We are also able to talk to them, give them health education in terms of the use of needles whereby they don't share.
Hiyo sharing nikitumia yako sijui status zako. Sasa facility imetusaidia sana juu tunakuja hapa mtu akiwa mgonjwa hapa uwezo unachukuliwa kama binadamu. Yaani wanataka tuingiane na raia ingine juu community ilikuwa imetutenga sababu sisi ni watu wabaya.
Are you comfortable with the strategy ya community RT group distribution? Is it good?
We've had several focus group discussions, and because of this, then there is reduction in stigma, more acceptability of the community to seek for preventive services as well as curative services, and this has really helped us in terms of seeing the numbers of people that we've been able to put on treatment and those who have been able to stay on their treatment.
It has really improved my way of doing things because these days we go to our meeting area and at a certain time we are just brought those things where we meet.
Naweza tuma mtu ama mtu tutume mtu aende, hata kama siko wamejua nyumba yangu, dawa wataniwachia tu hapa. Mimi nikikuja nitapata. Kwa hii group tuko na watu wazuri sana. Kama mtu amepata sida, hata kama nimegonjeka kidogo hii wakati wa hii COVID, unapata kama wote wanakuja.
So it has been able to save time, and also they have been able to learn with one another things that are related to HIV. They're able to understand HIV better, and issues of adherence have been able to improve because they've been taking their medication well.
Initially watu walikuwa na woga lakini sasa iliondoa woga.
In the month of February 2021, we were able to launch a project with the NMS and PS Kenya, where we were able to have self-testing kits at the workplace here in Naivas. And employees were very free. They were able to go and pick their kits during their break time, and it was taken very, very well. Apart from that, employees were able to reach out through the SMS service and the WhatsApp, where they were able to get more guidance after they tested themselves. Before that, the NMS facilitators, which we say thank you very much, were able to come and train 20 of our occupational health and safety members who also became our peer educators in terms of HIV and AIDS. So we are hoping to continue with the journey until all our staff at the workplace are able to get these self-testing kits.
We've been working with Nairobi Metropolitan Services to bring these services closer to men where they work particularly. So far we have had over 2,000 HIV self-test kits being accessed, and more stations actually asking us to bring the self-test kits. So we have a lot of people in here. So any effort that we do to take care of them, especially where they are, so that it's comfortable, it drives us to make sure that we have a healthy workforce.
We've not been able to do as much advocacy as we wanted to do among our leaders. Another thing, COVID struck, and then there was a lot of, containment of people, and children are not going to school. We've seen a rise in teenage pregnancies. So we need to focus both on the adolescent girls and young women, but also the young men, to understand about taking responsibility. Another challenge that we've come across is suppression on the children. Viral suppression has not been optimal. We are still struggling with that. I believe we can address these challenges. We have already come up with a draft County AIDS Strategic Plan number 2 that we hope to implement, and part of these challenges have been captured there to address this pandemic in the city.